And you said you're not aware of any misinformation in the comments to the Department of Public Health's social media posts.
You already asked. Witness already answered.
I have not seen any of the posts. I am aware that there was a lot of misinformation that other people were contributing on our sites that was creating a lot of confusion. But I didn't see those posts, and the conversations I had was that they were happening and they were problematic, and there was a lot of them.
And do you recall what kind of misinformation was being shared?
I don't recall the details. I think a lot of it was around vaccines and masks, but I have no details and poor recollection.
And you were concerned about that misinformation, is that correct?
I am concerned about misinformation, yes.
Why?
We're the public health department. People coming to our sites are looking for accurate information. And as the public health department, we take that responsibility very seriously.
And how do you determine whether a piece of information is misinformation or not?
We have a team of epidemiologists, clinicians, public health practitioners who work hard to determine what is accurate information. So I would say when the information is not aligned with what we've determined is accurate information, for us that would represent misinformation. You asked a hard question because there are lots of different ways people can think about misinformation.
And so if I'm understanding correctly, information that's not aligned with what the Department of Public Health has put out would constitute misinformation.
Objection. The witness provided her testimony.
I don't think that's what I said. It's not necessarily information that we've put out. It's information that we have determined is credible and accurate and based in science. Sometimes there could be misinformation circulating about a topic we have yet to present information on.
And so how do you determine whether something is credible and accurate and based in science?
There's a review by a team of qualified people at the health department that look at the information, that are versed in public health practice and research, and the appropriateness of research, and the epidemiology of disease, that actually are working together to make those determinations. There's no one person that does that job.
Can you name anyone on that team?
Yes.
Will you please?
Dr. Sharon Balter.
Anyone else?
Dr. Paul Simon.
Not the musician.
Not the musician.
Anyone else?
Dr. Dawn Terashita.
Anyone else?
It's a long list.
About how long?
Dr. Muntu Davis.
Anybody else?
I'm trying to make sure I have everyone's last names. I would have to give you some first names because I'm not sure. I think Dr. Prabhu Gunder, but I'm not positive about the last name. Dr. Zach Rubin. Dr. Rita Singal. There's, I'll stop there.
Okay, thank you very much. So tell me if my understanding is correct. If conflicting pieces of information regarding an issue came to the department, would this team that you just described meet and discuss and decide which is more credible?
Improper and incomplete hypothetical calls for speculation.
Different people on our teams have different areas of expertise. Depending on someone's area of expertise, they would be called to review documents. They would also be looking, obviously, at documents that were coming out of CDC, the Centers for Disease Control.
Out of CDC?